During the 78th United Nations General Assembly in New York, the UNAIDS, Governments of Botswana and the United States of America, together with the European Commission, have joined global partners to urge world leaders to get on the path that ends AIDS. In a statement, UNAIDS says that the partnership will also accelerate progress to reach many other of the Sustainable Development Goals. According to the UNAIDS data, new HIV infections are the lowest they have been since the 1980s, having been reduced by almost 60% since the peak in 1995. AIDS-related deaths have also been reduced by almost 70% since the peak in 2004. And around 30 million people now have access to HIV treatment, with 9 million still requiring access. To take this discussion further, we're going to be joined via Teams by Zeenat Abdool, Communication and Advocacy Officer for UNAIDS South Africa. Zeenat, good afternoon. Thank you for your time with us here on the SABC.
Good afternoon, Liesl. Thank you very much for the opportunity.
Perhaps as we imagine or reimagine the way forward, what does the path to ending AIDS by 2030 look like in a South African context?
Well, Liesl, thank you very much. And the path to ending AIDS requires political and financial commitments and succeeds when they are anchored in strong political leadership to do four things. And this includes following the data, the science and the evidence, tackling inequalities, enabling community organizations and civil society to play their vital roles, and also ensure sufficient and sustainable funding. Now, South Africa has made and continues to make significant progress in its HIV response towards ending AIDS as a public health threat by 2030. We're seeing the incidences of new infections and the rate of deaths steadily declining, but there remains a need to speed up interventions and programs to reach the UNAIDS 2025 95 targets. And simply put, this means that 95% of people living with HIV need to know their status. 95% of those who know their status are on treatment, and 95% of those on treatment continue to adhere to their treatment and have a suppressed viral load. But the targets for South Africa are currently sitting at 94, 77, and 92. So obviously we can see from there that there is a treatment gap where only 77% of people who know their HIV status are currently on treatment. And the treatment gap is even wider when it comes to children, because those targets are sitting at 65% for children who know their status on treatment at the moment. This is one of the challenges, which is to encourage people living with HIV to access treatment and not default on their treatment. And we need to bridge this gap by tackling the barriers to testing and treatment, which include societal and structural barriers. This is stigma and discrimination and income inequality. So while there has been progress, more needs to be done, and at a much faster pace.
Zeenat, thank you for that context. When we zoom out and look at the global picture, about 39 million people are living with HIV in the world. Perhaps we could speak to the life-saving impact of the global HIV response and the need for continued support, funding and commitment that you alluded to. I mean, there's the issue of food security and poverty. How has that also affected the response to HIV/AIDS at large?
So it's incredible how 39 million people are now living across the world, across the globe, which means that testing and treatment is working. But at the same time, we also know that treatment is prevention. So in South Africa, as I've said earlier, great strides have been made, but you'll also recall that these achievements and these strides were catalyzed by the civil society movement in this country. One will recall the Treatment Action Campaign in civil society having championed the cause for access to life-saving treatment. And today, South Africa has the largest antiretroviral program in the world. So we must also acknowledge that South Africa has funded 70% of its response, HIV response in the country, and also the extreme generosity of our donor community, including the Global Fund and PEPFAR. Speaking to your question, Liesl, about food security and poverty, I mean, this ties in ideally with the Sustainable Development Goals, the 17 Sustainable Development Goals, which were at the core and the focus of the General Assembly and the discussions taking place this week. And we know that inequalities drive pandemics and pandemics drive inequalities. So the achievement of the Sustainable Development Goals, which is tackling poverty, hunger, access to clean water, sanitation, and health and good facilities is key to the HIV response and to ending AIDS as a public health threat by 2030. So when people are faced with severe poverty, increased hunger, lack of clean water and sanitation, lack of employment, these conditions create situations which place their health further at risk, especially among populations at risk, such as in the case of adolescent girls and young women. So income inequality is linked to a higher HIV prevalence. HIV prevalence, HIV affects vulnerable communities most severely. Stigma and discrimination against these populations at risk is a major contributor to the high HIV prevalence amongst them, and is also linked to lower access to healthcare and housing. So protection against discrimination alongside legal services, rights literacy, access to justice and international protection, these can empower people to claim their rights and enhance access to HIV services. Speaking at the General Assembly and focusing on SDGs, even earlier this year, the Secretary General Antonio Guterres said in his SDG progress report and advocated for more to be done to reduce inequalities. We've seen that there is a political will at the UN General Assembly this week, with member states having adopted a political declaration to accelerate action to achieving SDGs. So it is important. We must keep in mind that when we bridge the divide or bridge inequalities, we're actually enhancing the pathway to ending AIDS as a public health threat by 2030 and beyond.
Zeenat, before we conclude this conversation, I wanted to look at the 95 targets that had been set. Right. Even countries like Botswana, Eswatini, Rwanda, the Republic of Tanzania, even Zimbabwe, really reaching those targets. I wonder what they're doing, perhaps to maintain that, to get on track. What could we be learning from them in this instance?
Well, education remains key, raising awareness remains key, and of course, reaching those targets, requires us to tackle inequalities as well as continue raising awareness. In South Africa, we are promoting with governments. So far, we've done this in the Eastern Cape Province, the Western Cape Province, with the city of eThekwini and the city of Johannesburg, rolling out the campaign of the U equals U campaign. And literally, simply put, U equals U means undetectable equals untransmittable. So with the support from partners in government and our networks, we are trying to advocate and raise awareness that by adhering to treatment and achieving a suppressed viral load, the HIV virus becomes undetectable in the blood, and undetectable means that you cannot sexually transmit HIV to another person. So awareness, education remains a key and vital and at the center of this. Of course, also tackling structural and societal barriers, such as stigma and discrimination. For example, we have some communities doing fantastic work. In fact, the theme for World AIDS Day this year is Let Communities Lead. And there are communities that are doing some fantastic work in tackling the issues and the barriers in their communities. And one such community that I can think of right now is on the Men's Forum in Alexandra Township, focusing on men, recognizing that men need to be tested in order for the HIV response in that community to work. So there are communities that are doing work. At the center of it is education and awareness raising.
Zeenat, thank you for those sentiments here on the SABC. Zeenat Abdool really just weighing in on the back of sentiments echoed at the UN General Assembly in New York. We've seen global partners at large urging the world leaders to get on the path that ends AIDS. Again, thanks to Zeenat for those sentiments.